Hello everyone, my name is Shalya and I'm the founder of Redot. Today we are here with Dr. Himani Joshi Bhatt. She's a dietitian practicing in Dehradun, Uttarakhand. Today we'll be asking her 10 questions. Dr. Himani, let's start. Before we do, can you please tell us a bit about yourself and what work you do?
Hello, Shalya. Thanks for making me part of this session. I'm an Ayurvedic physician and a nutritionist, and it's almost 15 years I'm working in this field. Yes.
That's great, ma'am. So we're very, happy and very honored to have such an experienced doctor with us today.
Thank you so
So
much. Thank you so much.
yes, ma'am. So we'll start off with the questions. Okay, so the first one we have for you is what are some of the most
Okay.
common unhealthy eating habits you see among students today?
I think the most unhealthy eating habits which youngsters are following nowadays is that they are not occasionally but regularly consuming junk food. They are making it a part of their meal.
Mm-hmm.
You know, it should be occasional, but it should not be regular.
Mm-hmm.
So that is a very wrong food habit. And, excessive intake of junk food, processed food items regularly on regular basis will definitely affect the health of the person. So that is a very wrong food habits which youth is following nowadays.
Yes. Okay, start with the second question then. I think that was a great answer. A lot of times, children also tend to, sort of go towards junk food because of stress and stuff like that. So, yeah, that's
Oh,
also something we should, sort of account for when we are trying to consider how to change our diets. All right, next question
right.
is many students skip breakfast or meals, and I've also personally done this because of school and coaching studies. How does that affect our health and energy levels?
It is very wrong to skip your breakfast, no? Because many patients comes to me and they say we skip our breakfast and then also we are gaining weight.
Oh.
After skipping breakfast, you are gaining weight. The reason is that when you skip your breakfast, you are basically slowing down your metabolism. And when your metabolism gets slows down, so that food is ultimately converted into fat in your body. And moreover, when you are skipping your breakfast, you're also, your immunity will get at a lower level. So there are more chances of having your infection. So it is very important to have a proper breakfast in the morning.
Okay, that's a great answer, ma'am. We'll have the next question. What are some signs that someone's diet or nutrition is negatively affecting their body? A lot of times, again, I've also personally gone through this. When 2, 3 years ago, I used to feel, there's some changes happening in my body, and I think it's because of my nutrition. And I, went on Google, I searched a lot. I was like, what am I eating wrong? And, how should I correct it? So I feel Google provided me quite a bit of misinformation, which actually ruined my diet further. So maybe we could go on a bit more that. But again, my main question is what are some signs that someone's diet or nutrition is actually negatively affecting their body?
See, the signs which we generally see if somebody is not having a proper, faulty food habits, if on regular basis, if somebody is having, the immunity will get weakened,
Hmm.
your immunity will, and uh, you will feel low.
Yes.
And the signs which you see, brittle nails, there will be lack of glow on your face.
Hmm.
So all these are joint pain because of deficiency of calcium, vitamins. Joint pain can be seen, numbness. All these are signs which are seen in the body due
Hmm.
to improper food.
Nutrition. Yeah.
Yeah.
Okay. Next question. And this, I feel a lot of teenagers have, questions about this is how important is protein intake during the teenage years?
Protein intake is not only important in teenage, but in every phase of life. Protein is very important. Protein is not only bodybuilding, but it provides you immunity also.
Hmm.
There are so many it prevents you from infection. So protein is very necessary. In fact, hemoglobin is also made up of protein.
Oh.
So if there is deficiency of protein, yeah, heme and globin. So heme is iron, globin is protein. So if there is deficiency of iron, so it can be even due to your protein deficiency. So protein is very essential, not only in teenage, but in every phase of life.
Mm-hmm. So you mentioned iron
So
as yeah.
protein is important. And one more thing, that how much amount of protein a person should consume. 1 gram per kg body weight. For example, if somebody is 60 kg, so at least 60 gram of protein is required by the person in
Oh,
general.
okay.
Yeah, this is the recommended dietary intake according to the books.
Oh, that's something I'm learning today. Alright. So you talked about iron, and our next question is connected to that. Iron deficiency
Yeah.
is very common among students today, and I'll be very honest. Even I have iron deficiency. I have tablets in the evening for that. So why exactly is that happening? Why do you think that is happening?
Uh, well, because if we talk about why the iron deficiency is occurring because of food, so mostly the person who consume excess of tea, coffee, in
Mm-hmm.
those people, iron deficiency is seen. The reason is that iron contain anti-nutrient property.
Mm-hmm.
Sorry, your tea, coffee, they have anti-nutrient property which inhibits the absorption of iron in the body. So to enhance the absorption of iron in the body, a person should consume vitamin C in any form. The best way is to have a glass of lemon water every day
Oh.
because it enhances your iron absorption in the body, and it can be even in form of like when you are having dal
Mm-hmm.
in your lunchtime.
Mm-hmm.
So you can just squeeze a little bit of lemon because vitamin C have a property of enhancing the iron absorption in the body. So this is a simple formula to enhance iron in body. And to prevent iron deficiency, one should consume less coffee and tea. And mostly it is seen
Yeah.
that excessive consumption of tea, coffee inhibits your iron absorption.
Mm-hmm.
And other causes can be worm infestation, but that is a different thing.
Uh-huh.
Yes.
All right. Our next question is, and social media constantly promotes dieting and this weight loss culture. How do you think that affects young people's relationship with food today?
Actually, the problem is the youngsters don't know what is the way to lose weight. Problem ये है कि आप you are having a piece of cake. If
Mm-hmm.
अगर आप compare करें between a piece of cake and a plate of dal chawal, so
Mm-hmm.
dal chawal is having low calorie as compared to piece of cake. Problem ये है कि वो you don't actually understand कि एक छोटा सा piece of जो cake है उसमें ज्यादा calories हो सकती है as compared to your dal chawal. And not only calories concerned in losing weight, but in which combination you are taking food, at what time you are taking food, that is also a very important factor in gaining or losing weight. What I mean to say is that you should have your main meal at proper time. You
Mm-hmm.
know, if you're having your dinner late night, so your metabolism is already slow. If we talk scientifically, like sun
Mm-hmm.
rises, sun so that works with our body also. When
Okay.
sun rises, metabolism gets boost. When sunset, metabolism slows down. So if you're having your dinner late at night, so it will slow down your metabolism. There is more chances of gaining weight. And in which combination you are having your food, there are multiple factors in concern with your weight gain.
Mm-hmm.
So
Okay.
just following your social media is not the right way to manage your weight. It is very important to consult the specialist in this field.
Yes, it is actually very correct. Getting proper medical, consultation, proper medical advice from
Yes,
somebody who
that
is,
is very important.
yeah, that's very important.
Yeah.
All right. So our next question is recently conversations around PMOS, which was earlier called PCOS, and hormonal health have become much more common online. And I think it's good because it's helping, dismantle the stigma. But from a nutrition perspective, how important are food and lifestyle habits in managing hormonal health, especially during PMOS?
It is, if I talk about PMOS in managing in managing your PMOS, so food and lifestyle play a very important role. because this is basically a hormonal disease.
Yes, yes.
एंड जो आप खाते हैं, स्पेशली आप देखेंगे जो द पर्सन हु इज सफरिंग फ्रॉम पीएमओएस is mostly having junk food items, packed, processed food item for a long period of time.
Hmm.
And it is basically a complex hormonal disorder. PMOS is a complex hormonal disorder in which, because of faulty food habits, our insulin has to work very harder,
Oh.
and this result in hormonal imbalances which creates PMOS in the body. So it is very, like, if I say, so 60% treatment of PMOS is through your diet, your lifestyle, and 40% medicine is required in curing PMOS.
It's very interesting to hear. All right, so our next question is, and it's very related to the question you just answered. Are there certain eating habits that can negatively affect hormonal balance over time?
Yeah, yes, as I told you, like
Hmm.
having for a long period of time, not occasionally, but regularly having junk food, packed, processed food items. You know? So definitely that will affect your body negatively. Oh, yeah.
Okay. Next question is, and yeah, so how can parents encourage healthier eating habits at home without creating pressure around body image or weight?
Pardon?
How can parents encourage healthier eating habits at home without creating pressure around body image or weight? And I'm sure you've gotten a lot of these questions in your clinic as well. Parents come up and they ask you, how do we sort of inculcate those good eating habits in our children, to avoid having, as you said, junk food and processed food a lot of times during the day. So,
Yeah.
like, how can parents do that without, saying that you're getting fat, stop eating? Like, that'll.
So firstly, I think that first parents has to follow that.
Yes, yes.
है ना? अभी देखेंगे, सबसे पहले पेरेंट्स को ही चाहिए कि वो उस
Hmm.
चीज़ को फ़ॉलो करें।
Yes, ma'am.
बिकॉज़ बच्चे ब पेरेंट्स को ही देखते हैं। So
Hmm.
when the parents will follow healthy food patterns, so definitely childrens will also follow it, especially जो हमारे छोटे बच्चे होते हैं घर में, बिकॉज़ जैसा आप उनको खिलाएँगे वैसे ही उनके टेस्ट बड डेवलप हो जाते हैं।
Oh,
सो आप उनको अगर जंक ही खिलाएँगे तो वही टेस्ट बड डेवलप हो जाएँगे, और देन द चाइल्ड विल आस्क फॉर दैट काइंड ऑफ फूड, और वो फिर आप अगर चाहेंगे भी तो वो हेल्दी फूड आइटम्स नहीं खाएगा। इवन प्रेफर ईटिंग योर वेजिटेबल्स, दाल, सब्जी, जैसे पेरेंट्स आते हैं मेरे पास, वो कहते हैं हम ये खाता ही नहीं है, तो रीज़न क्या है कि उन्होंने खिलाया ही नहीं है,
oh.
तो इट बिकम टफ।
So from like a small age, they should start sort of
हाँ,
doing
एग्ज़ैक्टली,
that.
बिल्कुल, पेरेंट्स को ही वो करना है इसके लिए।
All right, and this is our last question for this interview. What is one nutrition related message you wish every student understood earlier?
Well, I always say that prevention is better than cure.
Yes.
So
Yeah.
if like if आप अच्छा खाइए, you should eat healthy food, you
Mm,
should follow healthy lifestyle, which will not only prevent you from having disease, but it will also be helpful in reversing your disease, especially like diabetes, hypertension, your high cholesterol, fatty liver, all these diseases like PMOS, they can be reversed by just following the right food habits and lifestyle. So nutrition play a very important role, especially now.
mm, yes, ma'am, that's very
In
true.
current situation, आपके खाने का बहुत इम्पोर्टेंट रोल है, और आई कैन से दैट मोस्टली जितनी भी आजकल लोगों को प्रॉब्लम हो रही है, द मेन कॉज इज योर फूड हैबिट्स.
Mm-hmm.
सो what you are eating, at what time you are eating, in which combination you are taking that food, it is very important कि आप उसको properly manage करें.
Yes, ma'am. Thank you so much for answering our questions. We really
Thank you so
appreciate
much.
it. And
Thank
yeah,
you.
thank you so much, ma'am.
Thank you.